Webinar is Hello, my name is Jill Baker. I use she and her pronouns. I'm with the Oregon Health Authority. This webinar is to update you all on the development of the Youth Suicide Intervention and Prevention Plan for 2026 through 2030. The first 30 minutes or so of our time together will be me presenting. Please do put questions in the chat, but I'll probably wait for questions until the end so that the many folks who are vacationing or conferencing or unable to make it today can receive the update as well, kind of succinctly at the beginning. And then the second half of our time together, I have some specific questions for you all, hoping to kind of do a spot check of where I'm at in the development process, and then also naming some things that are already emerging that I want you all to be aware of. So please do use the chat feature, um, and we'll loop back to questions after the presentation. Um, we are going to be talking about youth suicide prevention. And so in case it's been a minute since you've been in a space thinking about or strategizing about youth suicide prevention, just want to name from the beginning that that's the topic of the day, and that we are human people, not robot people. And so pay attention to what your brain and your body and your heart are telling you about your readiness to think about suicide and how to prevent it today. I invite you to take a really big, deep breath. Some of us have been going back to back since you started this morning, and so really want you to get some oxygen in your lungs, move your shoulders, stretch your neck, and settle into the space. Knowing that this is recorded, so if this is not the time or day for you to be immersing in this topic, you can come back to it. I will not be offended. The hopes for today, I want to share where we're at with the YSIPP development. We have several pieces of analysis to kind of let you see the results of. I want to share some of the initial compilation of the Cultural Infusion Roundtable process that we many of us have collectively worked on together. And then to check in about whether or not we seem to be on the right track. Let me just, Zoom is doing a weird thing. There we go. So just as a reminder, all of the work of suicide prevention in Oregon fits into the Oregon Suicide Prevention Framework. So both the adult and the youth plan for suicide prevention fit into this framework that includes everything from primary prevention way upstream, things that we want everyone in Oregon to experience and feel and receive, all the way through to treatment specific services and postvention. And so the first part of the update is that we went through as a field to collectively update and culturally infuse our Oregon Suicide Prevention Framework. The original framework was done in 2020, led by the University of Oregon Suicide Prevention Lab. We borrowed from the CDC technical package for suicide prevention. We borrowed from the National Strategy for Suicide Prevention. We borrowed from San Diego Suicide Prevention Plan. And then we did a whole big hundreds and hundreds of pieces of feedback from the field to come together into these pathways to kind of bucket the work and guide what we are doing. And it was good and maybe even excellent, but it was missing special attention and cueing for cultural signs for suicide and the way that culture can impact suicidality. And so we went through a 6-month process with Dr. Joyce Chu to culturally infuse the Oregon Suicide Prevention Framework, and then to also infuse all of the initiatives in the Youth Suicide Intervention and Prevention Plan, which I'll just say YSIPP from here on out. So I have 3 examples of what that looks like. This is from that green section of the framework around safe messaging. So the top message there is what the original framework that was good and maybe even excellent. That was what our bucket holding safe messaging said. All Oregonians receive safe messaging about suicide and self-injury. The middle is the OHA suicide prevention team's first efforts to culturally infuse and to put equity at the center of that. The OHA suicide prevention team, prior to Dr. Chu's consult, had wording like people in Oregon receive safe messaging about suicide that fit their diverse community needs. And then the last one there you'll see is where we landed, with the crossed out text being what Dr. Chu originally had in there. And so wanted to include that to show you all that part of this work was a balance between being kind of concise and succinct, and making sure that we didn't leave out the cultural infusion pieces. So the new framework, the culturally infused framework, which is exactly the old framework but culturally infused, says people in Oregon receive culturally infused safe messaging about suicide in their preferred languages. And so you might be able to recognize how the strategies in the plan might look a little different, from where we started. All Oregonians receive safe messaging about suicide and self-injury, and that we're queuing up some culturally specific pieces to include, in that in where we landed. I'll show you one from the middle of the framework, around safe storage. So the original framework said all Oregonians experiencing a behavioral health crisis have access to safe storage for medicine and firearms. Through some of the work that we did with Dr. Chu, we learned that different cultures have different, most prevalent means for attempting and dying by suicide. And so if we're only focusing on medicine and firearms, we miss a whole swath of people. Um, OHA's attempt, without Joyce Chu, was all people in Oregon experiencing a behavioral health crisis have access to safe storage for medicine and firearms. And then we landed, with Dr. Chu's consult, with a pathway that reads all people in Oregon at risk for suicide have access to safe storage or other lethal means restriction options. So expanding it. So you'll notice in the cultural infusion, we didn't take away anything, but it expands and stretches the scope of the work. And then finally, here's one to show you an example from the culturally infused pathways for the treatment section. After we know that suicide risk is present for someone, the original framework said all Oregonians who access healthcare for behavioral health crises or suicide ideation receive coordinated care and transitions between levels of care. And then we landed with Dr. Chu on people in Oregon with suicide risk who access health care receive culturally responsive coordination between levels of care tailored to culturally preferred pathways of help seeking. And this again expands what we mean, by care and what treatment is and how people receive services and what services they want to receive. So in the documents that will come from Jen Fraga after this webinar, we'll be able to click on this link. This is the Oregon Suicide Prevention Framework with all of the pathways culturally infused. It's still in draft form because it hasn't gone through our publications process yet, but you're super open to welcome to open it up, read through it, and see kind of how the framework itself looks in a culturally infused way. That document includes definitions for some of the words that might be new to some of us, things like culturally infused, cultural broker, culturally congruent care. And actually, I'll see if I can, Jen, are you able to grab that link and put it in the chat so if people want to open it up during while I'm talking? Okay.
Yeah, I'll do that.
Thank you so much. I just wanted to name out loud before I launch in that building a statewide plan is a very, very large puzzle. That some of these pieces of the puzzle that are listed here are considerations that the OHA suicide prevention team and myself in particular are gathering, analyzing, trying to make fit into something that is concise enough to be used and comprehensive enough to make a big difference. So just naming, it's everything from over the last 5 years when we're in a meeting and somebody says, oh, we should do this. We have a list of bookshelf ideas that we keep and put them on the bookshelf so that we can grab them and look at them the next time it's ready. We're ready to strategic plan. We've asked many folks, what do you think we need to start, stop, and continue? We went through the cultural infusion process. We are nestling our plan into OHA's strategic plan more broadly and the behavioral health strategic plan. There's a national strategy for suicide prevention. Oregon has a whole bunch of requirements that I have to put in the plan that are in legislation. And you'll see a couple of those examples here today, a little bit later around analyzing anything new in social media, and what other states are doing for suicide prevention that have lower suicide rates than we have. And then, of course, we have all of our 185 current initiatives that we're working on that we already, as a field, collectively decided it was the next right step to do the work. And so a new strategic plan is an update, not a completely new plan. And so integrating the current work in, and then, of course, keeping in mind the time in which we're living, including funding considerations, but also any other outside factors that might be changing our landscape at the moment. So if you feel overwhelmed listening to me in the next few slides, this is, I think, maybe why, that there are a lot of pieces to pull in and to complete a picture. This is Dr. Joyce Chu's slide outlining, and actually I think there might be a little there's a little animation there. Okay. This is the timeline of the last 6 months around the cultural infusion process. So naming that the framework levels that I showed you earlier, those we have been trying things out, refining, checking with people, seeing how it fit from January to about March. March and April is when we got to initially present the culturally infused framework at the Oregon Suicide Prevention Conference. Prior to that, we had a community input process that was supported by Dr. Chu and the Cultural and Suicide Prevention Institute, and also then that work was analyzed by the University of Oregon Suicide Prevention Lab to ask folks what is Oregon doing well, and what do we need to work on as it relates to culture and diversity and equity in suicide prevention. We had some successes and some very big barriers to that process. The robot behind the text there is to indicate that our focus groups, which we publicly advertised stipends for, were inundated with bots, and so we had to pivot and try again, as is life, pivoting and trying again, right? That work was analyzed. The Culture and Suicide Prevention Institute folks prepped for a series of meetings that we called roundtables with the learnings from that survey and those focus groups. And to just name what those roundtable groups were, we kind of combined the field of suicide prevention and some of the big projects that we're working on in kind of like job-alike categories. So categories that would be similar to the work that they were doing, and to think about what would cultural infusion of your work look like. And so here's the list of those large roundtables. And each one of those roundtables then generated initiatives that are included in the new YSIPP, the YSIPP 2630, that are specifically culturally infused initiatives. And I'll show you a few examples. Just to caveat, the Big River Collaborative number 4 there ended up being too big, that there were some things that the group together needed to talk through, but it became clear that the Big River coordinators and the Big River programs themselves for suicide prevention training needed some more specialized and individualized attention. And so Dr. Chu and her team met individually with Big River folks as well. So you'll see when the YSIPP comes out, you'll see umbrella Big River initiatives, kind of big buckets of them, and then have what each Big River program is doing in that umbrella underneath. And so it'll be structured a little bit differently than the current YSIP. Um, Allows for a bit more tailored initiatives by Big River programs. You don't have to read this. I just want you to see the color difference to say that in addition to all of the roundtables, Dr. Chu went through all of our 185 YSIP initiatives that we're currently working on and assessed them in these categories. So either she checked a current initiative and revised it slightly to have suggested language for cultural infusion. Um, Marked it orange, which meant it already was culturally related. About 26% of our 185 initiatives already were culturally infused before we started this process. So that felt pretty affirming about the work that we collectively have been trying to do prior to this process. Um, there are a whole bunch of new initiatives that are culturally specific or cultural initiatives. Um, and then there are some that were existing in the YSIP, will remain in the YSIP, but aren't specifically cultural. And I think I have a couple of examples of what I mean by that. So here's an example of an adapted initiative. So this initiative went through in the roundtable, the sources of strength in the Matchstick team working with Dr. Chu adjusted their language to be what was originally named English and Spanish, and to be able to add in languages other than English, and add in specifically that Oregon's team will elevate specific language needs to their national organization. So that's an example of it shouldn't look completely different in the new YSIP, but it's just better. It's more infused. Here's another example of the being able to talk about different methods of lethal means other than firearm and medication. Um, and so adding the words and other means used across cultural groups to an existing initiative to just expand who it is we're reaching and who it is we're speaking to. Here are a couple of examples of brand new initiatives. So these are initiatives that showed up newly in the YSIP, things like integrate culturally responsive resources and referral processes into standard protocols for screening for suicide risk in schools to reduce cultural, linguistic, and systemic barriers to care for students and their families. And so even though a lot of people, when they are screening for suicide risk in schools, already do have culturally responsive and culturally specific resources and referral processes, it now gets to be in the YSIP as policy. So everyone who's working on that is cued to think about it. And then over the course of the roundtables, also discovered that there was different levels of readiness. Some groups and some projects within groups were really ready to dive all in on adding in different ways of asking about suicide, different ways of resourcing folks for levels of care, different understandings of what mental health is between cultures, those types of things. And then there were other groups that weren't quite ready. So I picked one as an example. This was in the treatment-focused roundtable. That broadly, as a children behavioral health services system, we needed kind of a more first right step or next right step initiative. And the wording there is to maintain and expand a strategic list of state level routes and mechanisms to integrate cultural infusion into children's behavioral health systems to support ongoing system improvement and equity driven action. It was clear that we needed to start with like, what are our levers for change? How do we know where we can make influence and infuse culture versus ESA, which is one of our children and family behavioral health programs for early onset psychosis, has the right buy-in and the right amount of prep work done to have this be their initiative. ESA's Center of Excellence will develop and implement a culturally infused ESA model that integrates culture, diversity, and equity into screening, assessment, safety planning, intervention, practice guidelines, protocols, trainings, and conferences. they're ready for all of that. They talked through like what that would look like, um, and are ready to launch it. And so you'll see various levels of specificity about what cultural infusion looks like based on readiness from the roundtables. And then lastly, here's one impact that I wanted to show. Whoops. Come on, little guy. Here we go. Around a system-wide impact that for Big River. Through the Big River roundtables, it became clear that there were some kind of repeated themes around evaluation and specifically how we do evaluation. And so wanting to include and call out community, the way the strategies for evaluation, things like community-based participatory approaches, qualitative approaches like storytelling, interviews, focus groups, and then some particular populations to support as well. And so naming that is an example of an umbrella for Big River and the how and what strategies QPR and BSBB chooses might look different than Youth Save, but that naming some of those kind of more culturally congruent evaluation strategies was important. Okay, I'm gonna take a deep breath. Everyone take a deep breath. We're pivoting. That was the roundtable piece of the puzzle. And so that produced a spreadsheet that has 400 lines on it. Pivot. And so it's a very large piece of the puzzle, the roundtables and cultural infusion piece of it. But it wasn't the only thing on that list to remember about how to what we need to include in building our statewide plan. One of the things that we wanted to include was to kind of lump together or having analysis of the question that we asked over and over and over again to these. This is a list of groups that received this question: the Alliance Executive Subcommittee, Big River coordinators, and OHA Suicide Prevention Team, the 9 Tribes Prevention Quarterly meetings. For those of you who are at the Oregon Suicide Prevention Conference, you participated in this. And we also did this with the Oregon Adolescent and Child Psychiatrist group. And so asking, what do we need to start? What do we need to stop? And what do we need to continue? And so then Jonathan Rochelle and his team at the University of Oregon Suicide Prevention Lab themed them inductively, as in read through all of the feedback from all of those groups and put them into buckets of themes that weren't predetermined. So kind of whatever emerged is what you will see in front. And so, and in the categories of start, stop, and continue. So what did folks say that the field of suicide prevention needs to start doing or do more of? The largest response or frequency was kind of around making sure people knew what we have, so dissemination, and doing more of the good work. And so not necessarily pivoting entirely, but to continue to expand and grow what is working. Followed by, and so 52 is the number of frequency there, followed by 48 around advancing equity and culture. And so that felt really affirming to the work and the direction that we have been headed. Knowing that not super far behind their youth support and empowerment, youth voice is loud throughout. You'll see that over and over and over again. And then making sure that community is involved, particularly around reducing stigma. What did folks say we need to knock it off about? Well, what we need to stop doing includes spending money in places that aren't aligned with our values, spending money that is not equitable or equitably distributed, and then lots about wanting more coordination, that systems feel disjointed. And a lot of the feedback wasn't necessarily about OHA or or its programming. Some of it was, but it was like broadly that school system, whatever system the person was responding from, it kind of didn't discriminate against. It was just like a lot of our systems are disjointed and need to work together more. Other high scoring knock it off categories are making sure that we pay attention to not just centering whiteness and excluding others or excluding those who have historically been marginalized, and then waiting the delaying action and responding with silence. Those themes were kind of really loud in waiting until there's a crisis, that people are only willing to act or do or fund or make change after someone dies or after a bad thing happens. And then what do we need to continue? So this question would be like, what's going well that we need to make sure that we don't let drop off in the next YSIPP? So culturally and community informed prevention strategies far and away was the loudest here. And then making sure that we have events, ways to gather, keeping our infrastructure well supported, and then making sure evidence-based practices or good work is able to be distributed and disseminated. Um, Okay, and then this question is, what do we want to say is true in 2030? Like when 2030 shows up, what do we want to say is true about the field of suicide prevention? And then Jonathan Rochelle and his team mapped it into the framework, into the Oregon Suicide Prevention Framework. And so we kind of used this as a strategy to say, where do you want us to focus the most? If we're looking at an ease impact analysis, because there will be 1,000 ideas and we can't do all 1,000, but where should we look and make sure that we are increasing numbers of initiatives or projects? And so this is flipped. The most frequent was around coordinating. So you'll map that to the theme of disjointed systems. Information dissemination, that shouldn't be a surprise, talking about wanting to make sure people know about the good work that is out there. Culturally specific programming, and then addressing policy gaps. And the policy gaps category included a lot of things, but included several recommendations for legislative concepts, funding needs, and in particular unfunded mandates. What do we need in order to get that happen? Most people said we need more people trained. And so making sure that everybody knows their role in suicide prevention. The appropriately trained community pathway includes which trainings get offered to whom, and includes making sure that we are expanding who identifies as a suicide preventer or someone who is in the field of suicide prevention. So all of that is foundational analysis that will be included in the YSIPP. You'll see the results of those, and it will inform kind of where we're putting prioritization and focus based on some of that information as well. Okay, this is so good. Okay, so the legislation requires that we look at what's new since the last plan was published, specific around social media use and youth mental health and suicide. So this is a thing that we have to include this topic each time. So the UO lab did a kind of literature scan and new practices scan. And here are some of the key findings. Much more will be in the YSIPP when it is published. It's super, super fascinating, but no surprise, social media use increases rates of depression. There's a causal relationship and suicidality, that the amount of time a young person is on social media impacts. Particularly, there's a three or more hour cutoff that you can see in the data, and that how social media is being used matters. So in particular, if passive scrolling has self-harm content, kind of a really emotionally charged content, has an impact on increasing depression and suicidality. Social dynamics matter if there's cyberbullying involved. I asked Jonathan to go back and look at age, whether or not there's an age impact about onset or start of social media use, um, and to look at the literature around whether or not racism connected bullying has a higher prevalence or makes a bigger impact. Um, there were specific populations, female identifiers, LGBTQ2SIA plus youth, and those with who already experienced clinical risk for depression or suicide are more vulnerable to harm from social media. And then very, very loud around sleep. So that not just the amount of time that young people are using social media, but when it impacts their sleep and their sleep is disrupted, that increases risk. And then general findings around any sleep loss in general increases risk. Super interesting study included in that scan around I think 11-year-olds or eighth graders. Maybe those are 11-year-olds or fifth graders. So I can't remember. But a young person who
Correct.
gets eight, what's it?
Yep, you were right. 11 years old.
11 years old. Thank you. It's like you did the work and I'm just parroting your work. That 11-year-olds who consistently get 9 or more hours of sleep, that you can see the difference in their depression and suicidality later in adolescence. So lots to be learned there. And so these learnings will hopefully show up in the YSIPP as well. The other legislatively required piece is that we would put in kind of what are other states doing. One category is states that have the 5 lowest rates of youth suicide. So you can see Oregon is the dotted line on top there, compared to the 5 states with the lowest rates of suicide. Here are the lessons from those states. Everybody has a statewide coalition, like the Oregon Alliance to Prevent Suicide. 4 of the 5 of those states with the lowest rates require all school staff to complete a non-annual suicide prevention training. And the 5th state, which I think is New York, has similar legislation pending right now. And then some other notable projects or initiatives in those lowest rate states include looping in anti-bullying protocols, focus on zero suicide, a requirement for colleges and universities to implement suicide prevention. So something similar to Addie's Act, which is one of the legislative concepts that I'm going to ask you about here in a minute. And then anonymous crisis counseling and reporting in Connecticut connected to Sandy Hook Promise. Because he's an overachiever, Jonathan Rochelle also looked at comparing Oregon to the 5 states that decreased had the highest decreases in suicide between 2018 and 2023. And so you'll see that's a different list. These are states that experienced decreases in rates of suicide, including Oregon, since 2018, wanting to see what strategies those states employed. Not a shocker, all of them have a statewide coalition, like the Oregon Alliance to Prevent Suicide. 3 of the 5 require that school training non-annually, and then the 4th has an annual requirement for that training. Colorado had a sources of strength in schools focus, so that feels affirming to our sources of strength work. And then the coalition, one of the states had a coalition that created an LGBTQ plus specific work plan. So it wasn't in their statewide plan, but their coalition had the work plan, and that was one of the learnings from that state. Okay, take a deep breath. Here are some things that are coming up as themes and lessons that are emerging as I go through and pull puzzle pieces together. It is very apparent to me that we need a way for the Oregon Alliance to Prevent Suicide to kind of flag what they want to keep an eye on. We have 185 initiatives. We'll probably have more in 2026. And while all of the good work is good work, keeping track and monitoring, which is one of the key essential functions of the Alliance, is difficult. We will have more ideas than we will have time, energy, and money to do. And so we'll need to look at it through kind of an ease impact. So what kind of impact will this project have and how many resources do we need? Money, human or otherwise, expertise to do that. And so there will be things that are bookshelved through the process. I am going to need your help specifically around prioritization of what legislative concepts you want and think OHA should champion. The list of potential legislative concepts is pretty long, and so and we usually get 1 to 2 each legislative session, which means we might have 2 to 3 in this 5-year plan that we can really champion and lean all in. Um, uh, I'm still working through the lists, so I don't want to send out that survey to ask for your feedback too soon. But just naming that survey will come from Jen Fraga through the Alliance listserv, and so if you need to be added to that, go ahead and put your name and email in the chat, and Jen can make sure that you get added to that listserv. I think it'll probably be towards the end of next week when that survey would come out. Uh, I, this idea that's emerging is around kind of like my YSIP. So, um, thinking about uh, thinking about that the YSIP is so big and we all can't keep track of all of the things. That's my job and OHA's job to do. But being able to filter by what it is that you're working on so that you kind of have your YSIP nestled in the framework. That counties could do that, school districts could do that, that sort type of thing. Big River coordinators and programs could have this is my YSIP, these are the things that I'm working on. So I'm toying with that idea as a way to make it more digestible for folks. Um, and then the other theme that's emerging is that there will be more ideas that we prioritize than we will have funding for. And so in addition to legislative concepts, prioritization, I'll aim to have priced out what a fully funded YSIP, what a fully funded culturally infused YSIP would cost. And that has some pretty heavy implications for the 27-29 legislative session.